Okay, I'll call this meeting to order, which is the Finance and Property Committee. And before we start, Karen Cook will read our land acknowledgement.
Before we proceed, I would like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850, and that we are all treaty people. This land is the traditional territory of the Anishinaabe people and is also part of the unceded territory of the Algonquin Nation. I would also like to acknowledge that the Métis historical presence I encourage everyone to think about how they may contribute to success and conciliation.
Miigwech.
Thank you. So we called this meeting to order, and I would like someone to move the approval of the agenda, please.
Yeah.
And a seconder. Aaron? Be it resolved that the Finance and Property Committee agenda dated June the 26th, 2024 be approved. Any discussions? Anything, any additions? Nothing? No, we're all good to go forward. Okay, we'll do a recorded vote. Rick?
Yes.
Karen?
Yes.
Blair? Isn't joined yet?
Language was stuck in my throat.
Sarah Inch? Yes. Jamie McGarvey hasn't joined yet either. Jamie Restuel? Not either. Tim Shepherd?
Yes.
Myself, yes. Catherine still is off. Morris?
Yes.
And Dave Wolf.
Yes.
Motion is carried. Okay, moving on to conflict of interest declaration. Does anyone have a conflict of interest or pecuniary interest to declare at this time? If not, don't forget you can still do it if something should arise. Moving on to 4.0, the approval of the previous minutes. I am looking for someone to move and second the Property and Finance Committee minutes of April the 24th, 20. Rick. And seconded by Tim. Be it resolved that the minutes from the Finance and Property Committee held on April the 24th, 2024 be approved as presented. Any errors or omissions noted? We proceed to a vote. Rick?
Yes.
Karen?
Yes.
Blair? Sarah?
Yes.
Jamie McGarvey? Jamie Restuel? Shepherd?
Yes.
Myself, yes. Morris?
Yes.
Dave Wolf?
Yes.
Motion is carried. Okay, moving on to 5.0 date of next meeting. So we have, this is going to be an intense meeting today, and then we have a little bit of time off before we have to meet again. So the date of our next meeting is September the 25th, 2024, the time and the location to be determined. No business arising. So moving to 7.0, which is new business. The insurance program annual report. And I'm not sure who would like to speak on that. Go ahead, Isabel.
Okay, most of the information is in the briefing note before you, that it's one of the requirements to speak about insurance on an annual basis. And we do have a resolution before us today to to endorse keeping with the same provider that we are using at the current time. I'll entertain questions. Anybody has any questions about the current provider?
And move to approve the resolution. Could I please have someone move resolution 2? So we can put it on the table. Sarah? And Chris, thank you. Whereas the North Bay Parry Sound District Health Unit has held a contract with the Healthcare Insurance Reciprocal of Canada, HIROC, since 2013, and whereas the service provider and costs related to the service have been very satisfactory to management and the Board of Health. Therefore, be it resolved that the Finance and Property Committee recommends that the Board of Health for the North Bay Parry Sound District Health Unit approve continuation of the contract for the general insurance program with the Healthcare Insurance Reciprocal of Canada until notified of any changes. And furthermore, be it resolved that the Finance and Property Committee be updated annually at minimum on insurance matters. Any further comments, questions, queries? Move to a recorded vote. Rick?
Yes.
Karen?
Yes.
Claire Flowers? Sarah Inch?
Yes.
Jamie McGarvey? GB Restool? Tim Shepherd?
Yes.
Myself, yes. Morris?
Yes.
Dave Wolf?
Yeah.
Motion is carried. Moving on to 7.2, the Risk Management Assessment Report.
I guess, you have before you a report on our risk assessment process. We didn't make as much headway with it this year as we envisioned when I gave this report last year, but following that, the whole merger thing took over for a few months. So we are working currently on, the risks associated with not being in a position to merge with anyone. And so that's the status we're at the moment. The high risks are noted. You'll notice if you were to compare this to last year's report, the numbers are a bit lower because we did close some things. There was a risk on for the move to Parry Sound and communication risk and things to do with the move. And that one was definitely closed. So I'm trying to think right now. I think there was one more, but the numbers are slightly less than they were before. Other than that, if there's any questions, I'll try to answer them.
Online, anyone have any questions? I guess we don't have anybody. And no one in the room has any questions?
I have a question.
Oh, Sarah, go ahead.
Can you explain the difference between the low, medium, and high risk?
So we go through a process. This is actually part of one of the things that High Rock provides us with. They have a database that we use and a whole program that you go through the steps. But the high risk would be high likelihood and high impact. And low risk is low impact and low likelihood, or something close to that. Like it could be combination. So one of them might be, say it's low impact and medium likelihood, it still might end up in low but we answer the various questions and it brings us to this assessment. But the high in general, it would be a high impact to the organization, and there's some high likelihood that it would happen. And it doesn't take into account that we may have a lot of mitigations in play. So we might say the one for cybersecurity. There's lots of mitigations we have in play, but the likelihood that it might happen, it's still high because it's happening all the time, right? So I hope that makes sense to you.
Yep, that makes sense.
Okay.
So could you expand on what you have in place for cybersecurity?
No, I can't talk about that here.
Okay. Thank you. That's all.
That's too risky.
That's true.
Any further questions? Has any? Okay. And we'll move on to 7.2, which I think you've kind of covered, or no? The risk management assessment report.
Yeah, that's the whole report. And
Yes.
It doesn't need to be approved. It's just received here.
That's right. I don't think we have. Oh, I don't think we have a motion to receive that report.
No.
We don't need one.
Oh.
Right? It's just for information purposes only. Okay, thank you. Okay, so then we shall move on to 7.3, first quarter financial statements, January 1st to May 31st.
Yeah, so we gave you a little bit more than the first quarters because
Yes.
we didn't do the March, but this is the situation with the health unit up to May of this year. Things are more back to normal, I would say, than you've probably seen since before COVID. And we have a number of vacant positions that are being filled. So there's, you'll notice that there's some underspending, and we're trying to get progress on some projects and some other things with the money. So as the year goes along, that will show up. But right now, this is the cost as of May 31st.
And the same for 7.4, right?
Yeah, so that's, the questions would be for Dr. Zimbalati if you have any.
So does anyone here in the room have any questions on the first quarter financial statements, which are actually to May 31st of this year?
Is there anything outstanding that you want to bring to our attention?
I don't think so. As I say, things are a bit more back to what I would call normal. And we don't have, last year we moved in Parry Sound, so there's like things are more, I hate to use that word because something will come up, but yeah, things are kind of normal at this point.
Anything that we should be watching out for that's going to trend in the wrong direction?
No, that I think not as of right now. I would say the only thing that we're working on is there's still requirements to do COVID work, and we did have a letter that came out from Dr. Moore recently saying that there would be some COVID money perhaps in the fall. But it's hard to plan knowing what we'll be eligible for and what we won't. So that makes it a little more uncertain. And we're also trying to plan now for the 2025 budget, knowing that we have 1% coming. So I think those are our two biggest things that financially we're working on. As an executive, we've been trying to produce some strategies on how we're going to make budget balance into the next year.
Has there been any indication of one-time funding above the 1% for any programming?
As I say, Dr. Moore makes an announcement, and then the people that I talk to say maybe. So that's about what we're getting. And it seems like they really don't have one-time funding until we give money back. So right now, at the end of July, the second quarter report will be sent in, and if they experience a number of health units having excess money to give back, then they have a bit of money to re-give back out again. But if everybody's as tight as we seem to be, I don't know how much will be available, and so that's, I think, why they're kind of not committing at the moment. And they did say that any applications for one-time funding that usually happens in September, October. And this year, they're only going to allow specific topics.
But we don't know what those.
But they don't know what the topics are.
One last one, if I may, because I don't recall. The salary increases. Did we cap ours at 1%, as a lot of broader public sector did for a period of time?
Well, we did but a kind of different time period. Like we capped ours early on, especially when we were getting ready to move into this building. So it would have been about 5 years ago we capped for a while.
So not under the mandatory when the province said, okay, so we're not going to be expecting any big numbers based on arbitration?
Well,
not from that. Anyway, yeah. So our contracts
I just couldn't remember.
are expiring March 31st of 2025.
Okay. Thanks. Thank you, Chair.
Go ahead, Sarah.
So I have a question about the needle exchange programs.
Yeah.
Because it's come up at the city, and people are wondering if it's still feasible to do the needle exchange, etc. It looks like we're below
We're
average, or
low cost perhaps right now. That's because the ministry has started to actually send us supplies rather than us have to buy supplies. So then the needles are coming in free from the province now, so it's one less cost that we're hoping to reduce the budget. Like right now, we think we're not going to spend this year or next year. Some of the stuff we give out, like condoms, the price has gone up. So we're shifting money around to pay for condoms instead of paying for needles.
So is that under the needle exchange?
The needle exchange line, I don't know which page you're.
I'm looking, 16 of 19, one-time funds.
Okay, let me go up a little bit. Because we were giving one-time funding that expired at March 31st, so that's one. It's probably what you're looking at. Yeah, so that was money that was one-time funding that expired at March 31st. But generally, this program is funded with cost share dollars. So it shows up under the substance use standard, which is on what page am I on? 14. And the needle exchange line in there on page 14 is the salaries and everything that are associated with that on page 14. In the second line down. So it says substance use and injury prevention on the left. And then the second line under that is needle exchange.
Yes, go ahead, Rick.
Just a comment. I know that we did a report on the Alpha conference, but one of the things that the Premier talked about after giving Dr. Moore accolades about how great the health units have done, especially during COVID, and that he's a numbers guy, and wherever the funding is needed, it will be there. So it's kind of read between the lines. We'll see how that works out. But everybody seemed to be happy about that part, but then we'll see what happens.
Yeah.
They're a number guy.
Need the details.
Yeah.
And just one comment to Isabel, if you need us to advocate for something, just let us know, right?
Yeah,
As the time goes on.
yeah. Right now, the other thing that's happening is the province is doing, not calling it the funding formula anymore. We're calling it the funding approach. They've started to do work on that. And so they started with some focus groups around the province. So it's going to be interesting where that goes. It's very open-ended questions and stuff at the moment. So
Is they're starting to work on it,
yes,
right? And there's consultation with.
there's consultation process going on.
Any further questions? Comments? Okay. So we will move on to item number 8 in camera, which we don't have. And number 9, adjournment for this committee. And we'll turn the meeting over to our chair, Rick.
Thank you. Motion.
We have 5 minutes.
We're doing? Okay.
5 minutes. We have to wait.
You've done such a great job. She's ahead of time. Great job, Mary Ann. You're awesome.
Sorry to do that, but it states that 5:25 meeting start.
Now another sandwich, right?
Yeah, or 2.
Look how it's under budget.
Marianne did such an amazing job to go over. Okay.
I know.
Timing.
And yes.
And the positions are open.
Oh. 2.
been done already. Before I call the meeting to order, I'd like to thank the Superior Bollier to come back and help us out on transition while Ashley the Kaplan is going to be the new, welcome the new executive assistant to our great group. So thank you, Sherry, for helping us out. And
Thank you.
Ashley, thank you for coming.
You blush. Thank you.
Oh, it's great. You deserve it.
I can stay open, Paul.
Okay, so call into order. Approval of the agenda. We need a mover and a seconder, please. Moved by Dave. Second by Karen Cook. Okay, moved by Dave, second by Karen, that it resolved that the Board of Health agenda dated for June 26, 24 be approved. Before I go for the approval, Jamie Larry will not be here. Catherine Steele is regrets, and Jamie McGarvey will come on when he can. Should be after 6 o'clock. So I need a vote. Rick Champagne, yes. Karen Cook,
Yes.
Sarah Inch,
Yes.
Jamie Rastool. He's not on yet. I apologize. Tim Shepard,
Yes.
Marianne Stickland,
Yes.
Morris Switzer,
Yes.
and Dave Wolf.
Yes.
Carried. Thank you. The conflict of interest, if anything comes up, just let us know and we'll note it. Number 4, presentation of North Bay Parry Sound District Health Unit Strategic Plan. Mr. Paul Morissette. Oh, sorry, Massacott. Where did I get that from? Paul Massacott and Danielle Hunter. Welcome. Sorry, Paul.
It's okay, Rick. Thanks. I'll just start.
Where's yours?
Thank you. So good afternoon. We're pleased to present details regarding the previously shared draft version of our refreshed vision, mission, and values 2024 to 2027 strategic plan requiring your approval. The work began in September of 2023 with the formulation of a strategic plan advisory committee comprised of employees representing programs and services across the health unit, and an experienced consultancy firm, Platinum Leadership, that was selected through our procurement process. The purpose of the committee is to guide the strategic planning process by ensuring the health unit commits to a process that is collaborative, transparent, accountable, evidence-informed, and effectively engages all stakeholders. The executive team was consulted and approved progress throughout the plan phases. The time and effort involved in getting to this stage the past 10 months has been intense. Danielle Hunter, our manager, planning, evaluation, and community services, has effectively project managed this work as the chair of the Strategic Planning Advisory Committee. We are happy to report that we are currently on time and on budget. Danielle will now take us through a presentation of the process to date, the outcome, and next steps.
Hi, everyone. I'm happy to be here this evening on behalf of the executive team, the Strategic Plan Advisory Committee, and Platinum Leadership to present the proposed 2024 to 2027 strategic plan for our health unit. In terms of an outline for the presentation this evening, I'll begin by providing a review of the phases of development of the plan and the activities that took place during each phase. Next, I will reveal the proposed renewed vision, mission, and values for our organization, followed by the 3 strategic priorities and their associated goals and strategies that will allow us to work towards our renewed vision and mission. If approved this evening, I will outline how we will communicate the launch of the new plan externally. And lastly, I will provide an overview of how the strategic plan will be operationalized by programs and services and outline a preliminary monitoring and reporting plan. Kicked off the strategic plan development with the vision and commitment phase, and this was back in September until November. So we had an internal kickoff. We did an all-staff town hall virtually, and that was facilitated by Platinum Leadership. We did a background contextual document review, which is typical as you start out a new strategic plan cycle. And that was gathering many contextual documents to get a sense of our current state at that time. We did an initial review of our current vision, mission, and values. At the time, we had an initial discussion where we decided we didn't revamp them completely, but just did a little bit of tweaking and editing. And then we started planning for the data collection phase. And so this was creating the survey, the questions we wanted answered from the community and our stakeholders, and going through all those different phases. Got through the understanding phase, which was the longest phase in the strategic plan. And this was from November to March. And this was where all the internal and external data collection took place. So we heard from 847 voices. We heard from clients and residents. We heard from staff, management, Board of Health members, and our community partners. Platinum Leadership then collated the information and themed it. They created the discovery report, which was included in your package this evening. And based on the data, they provided some recommended strategic priorities. We went into the direction phase, and that took place from March to May. So this is where the priority setting took place. We held a 2-day priority setting retreat. This was facilitated by Platinum Leadership and involved the executive team and the Strategic Plan Advisory Committee. Throughout those 2 days, we affirmed and renewed our new vision, mission, and values, and we affirmed 3 draft strategic priorities, goals, and strategies. From there, we established a writing team that met many times to kind of wordsmith some of the descriptors of our new values, wordsmith the priorities, goals, and strategies to ensure there was alignment and consistency. And then the last phase is strategy and launch. So during this phase, there was additional executive team feedback, additional crafting of the final draft priorities, goals, and strategies. And then the strategic plan document was developed, which was included in your package. And so that is where we branded and designed and included all additional information that is included in a full strategic plan package. And that brings us to the presentation this evening. And I will outline some of the launch activities towards the end of the presentation. I feel like I have my back to people. I'm sorry about that. So vision, mission, and values are the foundational elements that guide our daily work and help to position ourselves as public health within the wider community. A vision describes the future the health unit seeks to work towards. So our current vision right now is a healthy life for everyone in our communities. Our proposed new vision is a healthy community for all. So it's very similar. Essentially, we remove the possessive R within the statement. Our current mission is a healthy life for everyone in our communities. Our current mission is to foster healthy living within our communities by preventing illness, promoting healthy choices, and providing trusted support and information. And our new proposed mission is to foster healthy communities through partnership, preparedness, prevention, promotion, and protection. So essentially, this was tweaked to align with the vision where we have the communities within there, removing the our possessiveness, and we include all of those P's, which are very typical with public health programming and public health work. So the partnership, preparedness, prevention, promotion, and protection. And then lastly, with the values, so our current values are honesty, compassion, transparency, accountability, collaboration, and excellence. As guided by Platinum Leadership, it was important to ensure that our values are not what we aspire to as an organization, but they should reflect who we are currently. So we essentially changed the values slightly. So we kept accountability and collaboration. So we felt that honesty and transparency is captured in accountability. Equity is so foundational to the work we do that we felt it was a really important value that we captured during this round of strategic planning. And empathy captures compassion. So instead of having compassion, we incorporated that into the empathy value. In the strategic plan document, you'll notice that every value has a descriptor to reflect what it means to us as an organization. Ability, we serve responsibly with honesty and transparency. Adaptability, we respond flexibly to emerging needs, trends, and circumstances. Collaboration, we increase capacity and connection through partnership. Equity, we act justly and fairly, respecting unique needs. And empathy, we are compassionate and understanding. So the three proposed strategic priorities that we're putting forward is number 1, organizational well-being, 2, health equity, and 3, communication, connection, and collaboration. So we did discuss as a strategic plan advisory committee an order to the priorities, and we really felt like putting organizational well-being first was important to us. Because in order for us to serve others well and to serve our community well, we need to be well as an organization. So we put that as our top priority. So for priority 1, organizational well-being, the goal is to enhance engagement, learning, wellness, and development in our culture. Strategies are to establish pathways alongside employees for their growth and development, foster leadership through improved performance management and succession planning, nurture a psychologically healthy and safe workplace, and strengthen communication, understanding, and cohesion within teams and between programs. You'll notice in the strategic plan document that there's a rationale for every priority. It was important that we tied the goals and the strategies back to the data and what we heard in the consultation phase. So for this priority, many staff members expressed few opportunities to develop and advocated for greater autonomy in their roles. They also indicated many missed opportunities for collaboration between programs. By addressing these concerns, we will foster growth and development for people and programs, fostering a more cohesive and supportive organizational environment. We want to support and value our employees, promote mental health, and lead by example. By investing in our workforce, we position ourselves to meet future challenges with a robust and capable team. Priority 2 is health equity. The goal is to catalyze community attention and allocation of health unit resources to address social determinants of health. There are 4 strategies within this priority. The first is to strengthen organizational and public understanding of discrimination, racism, and racial equity as public health issues. I'm just going to have a glass of water. I normally don't talk a lot in my role. I don't do a lot of presentations.
Doing a great job.
The second strategy is to foster Mino Bimwadism, also known as the good life or the good way in Indigenous culture, with Indigenous partners, communities, and individuals. The third strategy is to advance initiatives to address mental health, substance use prevention, and harm reduction. And the fourth strategy is to cultivate our role within systems-level efforts to reduce poverty and homelessness. So the rationale behind this priority is that consultation feedback revealed a lack of understanding of Indigenous needs and culturally safe practices, and a need to bridge gaps in services. Racism and discrimination were seen as barriers in accessing services at the health unit and within the wider community, particularly among Indigenous populations. In addition, addressing substance use was broadly identified as an area of community need. Poverty and mental health were repeatedly mentioned as issues currently facing health unit clients and area populations. By addressing the social determinants of health, the health unit will support communities, environments, and populations with the highest needs. And then priority 3, communication, connection, and collaboration. So the goal is to bolster external relationships to enhance public health outcomes. There's 3 strategies in this priority. The first is to ground actions and relationships in our vision, mission, and values. The second is to raise awareness about the needs addressed by the health unit. And the third is to develop relationships with community partners to collectively advance shared goals. The rationale behind this priority is the vision, mission, and values of the health unit are the foundation of what we do and what we hope to achieve. So it's important that they guide the actions of every staff member in their daily work. Consultation feedback also revealed the need for the health unit to more effectively and more frequently communicate what we do and increase awareness of public health needs. Collaboration and increased connection will generate solutions to issues that broadly affect the communities that we serve. So that's an overview of the 3 priorities. Should the Board of Health approve the strategic plan this evening, we do have communication activities that are ready to go tomorrow. So first thing tomorrow morning, we would do a virtual town hall with all staff through Teams to introduce them to the new strategic plan. We will update our website and the internet with the strategic plan content. We'll do a news release and social media, be available for media availability if there's any inquiries, and also communicate our new strategic plan to our community partners. As mentioned in the previous slide, tomorrow will be the initial introduction of the new plan for most staff. It's important that programs and services take the time at their next team meetings to have discussions on how they see themselves in the plan and how they can help shape the activities that fall under the strategies. Throughout the summer months, the managers, with support from members of the Strategic Plan Advisory Committee, will have strategic plan discussions with their teams. P&E will support, the planning and evaluation team will support the strategic plan with providing supportive tools and resources such as work plan templates and reporting templates. Strategy leads and work group leads will be established and initial meetings will take place in the fall, and work plans will be completed by the end of the year. And work plans is essentially where we'll get more specific about the activities that will take place under the strategies. What are those outcomes and indicators, timelines, roles, and responsibilities? And beyond getting the plan off the ground, monitoring and reporting is also a key component to ensure that we fulfill our value of being accountable to what we say we're going to do. With the plan developed, the role of the Strategic Plan Advisory Committee does continue throughout the duration of the strategic plan, meeting quarterly to monitor progress, receive reports, communicate updates, and support the strategy leads. There will be an internal reporting requirement to update and submit work plans each quarter to the advisory committee for review, and this will start in 2025. Reports will be posted on the intranet for all staff awareness as well. And then updates on the progress of the strategic plan will be included in every medical officer of health report to the Board of Health. And then starting in 2025, we're proposing having 2 presentations per year to the Board of Health to highlight the work that's happening under a particular strategy or priority. And then lastly, strategic plan updates will be reported back to the ministry through our annual attestation. And that concludes the presentation of the proposed 24 to 27 strategic plan.
Thank you, Paul. Thank you, Danielle. Great presentation. This time we'll have questions or comments. Go ahead, Morris.
Thank you very much. And thanks for your involvement, Paul and Danielle. And I think, you know, I went through it pretty carefully, and I'm very impressed by the work. I have specific interests in communication and Indigenous issues, and I was delighted that the Discovery report, not delighted, but that they found this, but awareness of it, that there's a perceived lack of public awareness about the health unit initiative. And, you know, since I've been on this board, I've said, you know, it's when I look at the Dr. Zimbalati's reports, I'm astounded at the numbers of lives that this organization touches. That people just, they're not aware. And so I was really pleased about that. The Indigenous component, with regard to the acknowledgement, it's becoming more adapted by more organizations, that there is a specific mention of not just of the First Nations that are served, but of the urban Indigenous populations. North Bay has approximately 8,000 First Nations, Métis, and Inuit people, including myself, that live here. We pay taxes, and we contribute $350 million a year to the economy. this is from the Truth and Reconciliation Commission 94 calls to action. In order to address the jurisdictional disputes concerning Aboriginal people, Aboriginal was the terminology of the day, who do not reside on reserves, we call upon the federal government to recognize, respect, and address the distinct health needs of the Métis, Inuit, and off-reserve Aboriginal peoples. So I encourage you to consider that. I know that organizations like the Indigenous Primary Health Care Council, they use that language. In North Bay, we have one of over 100 friendship centers in Canada, 31 in Ontario that are providing services in conjunction with. We're one of your partners, and we've had some really good relationships. So I encourage you to take a look at at that. And the question I have is, where is the vision, mission, values, and priorities? Where is that going to be posted around the building?
So what we did last time during the plan, after the plan was launched, is we created a postcard with the new vision, mission, and values, and we placed that. We gave that to every staff member. So we haven't had discussions on whether we're going to do that this time around, but I think that's probably a really good idea. We also have something planned for our all-staff meeting in September. We're going to have a couple of exercises around the new priorities and the new vision, mission, and values. We do have a very specific strategy in priority 3 around integrating and ingraining vision, mission, and values in everything that we do and the decisions that we make. So that could look like reflecting it on all of our meetings, for example. So that's something we haven't quite articulated yet, but there's a very specific strategy around that, actually.
Thanks. And again, thanks specifically the two of you, but for all of the staff that really put a lot of time and thought into it. It's much appreciated.
Thanks for your comments.
Sarah, go ahead.
Thank you very much, Chair. So I'm wondering, and this is just simply because I feel it's good to have people feel safe to share, maybe diverse opinions. Was there any pushback against any of this from staff?
In terms of like what we selected, or
did you have any?
So we haven't introduced the plan to most of staff yet. Tomorrow is the initial introduction.
Okay.
I would say for the most part, among those who were part of developing and shaping what we presented tonight, so that was the executive team and the Strategic Plan Advisory Committee, we did use a consensus model. So when we were going through the vision, mission, values and selecting the strategies and priorities, it was important that we use that so we came to a consensus on what we were going to move forward with. I think, we had some really great discussions, I would say, in those meetings. We initially started with a set of strategies and we had to take some things out and rearrange things. And that was just more that we're really focused on, this is our path for the next 3 or 4 years. We can't possibly do everything, but it's really what we want to focus on for the next few years.
Yeah, and I just want to add too that the 13 people on the committee that represented various programs, all programs and services within the health unit, they were able to take back discussing. So a lot of this was discussed at their team meetings as we went through it. And there was a lot of feedback that came back because everybody is very passionate about the work. And they want to ensure that what they do is reflected in the priorities. So definitely took that into consideration. And we'll get more of that as we roll this out, and they'll see where that fits. So absolutely, it was all about consensus as much as possible through this. And, I just want to add the comment about what we do. We do so much, as you all know. And just a story before I started here, somebody asked me what public health was. And I said, oh, I had a dead bird at the end of my driveway. I had to call them to come and get it. Because that was what's important to me at the time. And it was public health. So until you use the services, you really don't know. And then when you got here and I spent the time and with all the programs, I realized all the tremendous work that's done here. And there's so much and it's so diverse. And it's difficult sometimes to explain what you do. You know, we're just not building widgets. And to your point is to get that message out there. So yeah, we definitely want to please everybody with this plan and make sure that they're seen as being part of it and they're engaged fully.
And one last comment, I think it's great that the focus is on being the billboard or being the poster. So like, you know, creating a healthy staff and promoting the health of the health unit in order to live that and be the model for the healthy community. And I hope that everyone understands the thinking behind that going forward. So, yeah.
Thank you.
Okay, thank you. Dave?
Was there Board of Health board representation on that committee?
No, there wasn't.
I'm not unhappy with it because we didn't have the involvement in it, so I'm not going to comment on the outcome. But I always equate, and this is not a point of criticism, so please don't take it that way. I always equate strategic planning and good governance as going hand in hand. And I feel, while I'll support it tonight, I do feel like I don't have buy-in on it. And I think we spent a lot of time talking at this table about how best to advocate for this organization and how to be assistive moving the organization forward. And many of the people around this table wear different hats. So I feel like it's coming to us at the 11th hour in a lot of ways, as opposed to being brought in sooner in the process. Again, not a criticism, just an observation, and maybe something that we can take forward for the future.
Yep, great comment.
Oh, that's fair. And it's a great comment, and I understand that from a governance perspective. And we have talked about that. The previous draft plan that went through the 2014 and 2018, we followed a similar path.
Right.
We did not involve, but then we upon reflection, when we did the retreat, for example, that would have been a perfect opportunity to invite some board members in, because we were at a point there to, to go through this. So I think in future, if Dr. Zimbalati and the rest of the board agrees, I think that would be a good time to bring in some board members.
I mean,
in our next plan.
At a minimum, and maybe the consultants did reach out and I missed it somehow or whatever, but at a minimum, we could, I think I would have benefited from an update along the way, knowing that this process was in place. Again, just other things that all of us are involved in the community, and I'm sure as members of council and so forth would agree, starting the process and knowing that the process is put in play, and then finding out at the end what the outcome is. I kind of look at us as being part of the team in a lot of ways. And I'll tell you that I'll get a phone call before any staff member will get a phone call about whatever we're saying we're going to do. So again, it's not a criticism. It's just an observation that let's not overlook the value that board members can sometimes bring to help shape the direction that an organization might want to move in, and the value of that early buy-in so that we can help advocate on your behalf as you move to operationalize this. I don't want it to sound like a down, because I will support it. I like where you've gone. It was a very nice presentation tonight, and I appreciate your time, and I appreciate the time that all the committee members put, because it was a long period to get here. So I fully acknowledge all of that. Please take it in the spirit in which it was intended.
I think this is something that we've discussed, and we do feel it was a bit of a miss. Well, not a bit of, but it's definitely something that we would do differently in the future. I think we had a bit of difficulty interpreting the response from the Board of Health to the survey in terms of engagement, and then. But I think moving forward, that is something that we would be doing differently.
Yeah, I appreciate that. Thank you.
Yeah, and be happy to reach out next time and, get your input incrementally to what we shared, like, for example, the operational plan that was presented back in November, we talked about how we were going to move forward the strategic plan at that time. So there was, I hear what you're saying there, and it would be great to include that in the next one. And we hear you.
Before I go to Morris, just a quick question. This was done in 2014, again in 2018, right? At that time, was there board involvement at that time?
Well, sure. I just want to understand the question. The 2014 to 2018 plan,
Yes.
it was the same as what we did this time.
Okay.
Then there wasn't one from 19 to now because of COVID.
Right.
We put that on hold. And then we did this one, and we followed a similar path as last time.
Great questions. Morris first, please.
Yeah, thanks again. I would ask your consultant why they didn't think that the board should be involved in different ways. But I hear what Dave is saying, and the strategic plans that I've been involved with in large organizations. It's important that the board be involved, but it has to be done in ways that it doesn't inhibit discussions. We're a pretty scary group, here. We don't want to intimidate anybody, but it's, it's a fact of life. People are very wary of what they say when authority appears to be in the room. So, but I think there are ways that it can be, the board can be brought in at different point. Now, some board members were interviewed in the process. I was one of them. We weren't completely forgotten. But I think, Dave has raised a good point. But I would ask your consultants why they missed that.
Okay. Thank you. Sarah?
Well, I just wanted to add a thought that every board is different, and I appreciate the fact that you consider us welcome to participate and include us in the future, and recognize that some boards have no interest in participating and prefer to rubber stamp things. So you can see where, maybe we need a happy medium. But thank you.
Well, again, great discussion, and all our comments are well valid, and I'm sure Paul and Danielle will take it back. And again, great work. Just echoing what Dave and Morris and everybody was saying is that I know it's a lot of work, and we appreciate it. And we're not. I know we're going to have a motion further down. I'm sure it'll get passed. And again, thank you very much for all the work you've done through Dr. Zimbalati and all the 13 people that were involved. Thank you again, and thank you very much.
And you're not scary.
Are you sure?
Smiling.
Not me, anyway. I'm not. No, appreciate your input.
Again, thank you, Paul. Thank you, Danielle, and thank the staff that are working at this. Thank you very much. And no other questions? I didn't miss anybody. Perfect. Thank you. So we'll move on to 5.0, approval of the previous minutes. A mover and a seconder, please. Dave Wolf. Seconded by Tim Shepard. I saw your hand come up. Be resolved that the minutes from the Board of Health meeting held on April 24th, 2024 be approved as presented. Vote on the matter. Rick Champagne, yes. Karen Cook.
Yes.
Blair's not on. Okay, we'll just move down. Claire Inch.
Yes.
Tim Shepard.
Yes.
Mary Ann Stickland.
Yes.
Morris Switzer.
Yes.
Dave Wolf.
Yes.
Carried. Move on to 6.0. The date of the next meeting will be September 25th, 2024. Enjoy your 2 months of holidays. Time will be determined. Business arising, 7.0. Nothing arising. 8.0, report of the medical officer of health. Floor is yours, Patty?
Thank you. And so the report is in your package. Time of writing, I can provide a little bit of update on some of the couple of topics that I highlighted in my section of the report in terms of strengthening public health. So we did provide feedback on a draft set of public health standards that were provided to us for review. We had just under a month to review a set of 14 protocols as well as standards. And there was quite a bit of feedback we provided, and similarly, it appears that many other health provided similarly robust feedback, as well as there were other organizations such as PHO who was part of the process, and other organizations. And the sense we're getting from the ministry is that they realize there's a lot of work to do on them than they had originally thought. And so we're not exactly sure what they're going to look like, but it sounds like they are taking the feedback and, are willing to make changes based on the feedback. We don't know to what extent, but it's a bit of a wait and see. So the initial timeline we were given was that the new standards would be effective January 2025. More recently, been indicated that they will be released now January 2025 with an implementation date, an implementation plan to follow. So taking the feedback, and hopefully there will be further opportunities as well. You heard Isabel mention that also under the strengthening public health area, that they have just started doing a review of the funding approach. And so there are a number of organizations who are providing back there as well. Isabel is on the executive for the Public Health Administrators organization, so she provided feedback based on that as well. I do believe AMO is being consulted on that, as well as other organizations. So we'll hear more on that, but we don't anticipate to hear anything concrete based on that review as soon as the standard. And then maybe I'll pause just for questions regarding strengthening public health and provide us.
Do you have any questions for, go ahead, Morris.
Thanks again for really helpful report, Dr. Zimbalati. I had one question here. There was a reference to divestments of roles or responsibilities that health units were seeking. What specific ones were there?
So there are some functions that were in the Ontario Public Health Standards that, could perhaps be re-leveled to other organizations. Some of the data collection or analysis, is that better housed at PHO, where it can be done more consistently across the province and they can be a resource to public health. There's some items such as vision screening, which we had been doing in the schools, but is not necessarily an evidence-based practice. So that's something that, if we're looking for savings, I think is a bit of a low-hanging fruit in terms of not doing that. So there are a few things either to be re-leveled to a different organization versus just reevaluating if it's the service is being delivered at all versus, is it being delivered in a different way.
helpful. Thanks.
Any other questions for Dr. Zimbalati?
Just provide a brief update then on the per and polyfluoroalkylated substances, because we did have the information session, which was hosted by the City of North Bay at Memorial Gardens last Thursday. The Ministry of the Environment, Conservation and Parks was also there presenting, as well as the Department of National Defense. We had a booth and we presented as well. And I would say that there was a very engaged crowd there, and I think it was positive for the health unit. We had lots of interest at our booth, lots of questions about what individuals can do in terms of their own water treatment systems. And we had two public health inspectors who were at our booth who are very knowledgeable about water treatment systems. And so I think the public really appreciated just having that face-to-face opportunity to ask questions and get really detailed information on what they can do. And also there is a lot of questions about, how is the local situation going to be studied? And it gave us the opportunity to highlight some of the advocacy we're doing around inclusion in a broader study to really understand if there may be an association between the higher PFAS levels that is in the North Bay drinking water and potential outcomes here. Of course, there's always going to be a lot of factors which can also affect population's health. And we know in Northern Ontario, our health outcomes tend to be lower than the rest of the province as well. So there would be things to tease out, and it would just, possibly be a suggestion as to whether there is an association if we were able to have the local population included in a study. But I think it would be a positive step to be engaged in that kind of work, and that the public can have the knowledge that it is being looked at.
Thank you very much. Any other questions for Dr. Zimbalati? Thank you very much. Do you got any more to report? There is.
Beyond that, if there are any questions on the rest of the report, I'd be happy to.
Yes, Sarah?
Are you able to speak in more detail to the vaping data that was collected and for the students in the Ontario Student Drug Use and Health Survey?
So that would come from Justice Survey.
Oh, I can speak to that. Yeah, I can't speak to more of what the data entailed, but I can say that we're working to put that on our website soon. So we're analyzing that data in segments. So based on different indicators, Healthy Schools requested that the vaping data be analyzed first. So we've done that kind of segment. We should have it on our website in the next few weeks. That's what we're working towards. And I believe the next set of indicators we're working on is mental health. So there is a lot of data, so we're just kind of working on it in segments and as it's prioritized by some of our programs.
Okay, thank you.
Thank you, Danielle, for your insight. Any other questions?
I had I had one question about the forever chemicals. The $20 million cleanup that apparently is going to be the primary responsibility of the Department of National Defense, apparently, from what I read. But I don't recall there being any timeline to the cleanup efforts.
So at the presentation on Thursday, the Department of National Defense did go through the initial phase of, which is the $20 million project, not saying necessarily that would be an end to it, but that was a phase that they were committing to. And it appeared that primary cleanup, which involves the area around the firefighting training zone, would be completed by the end of 2025.
Okay. And a comment, Chair. We were talking about earlier, I mentioned about how it's good to see whenever I see any media coverage or any, of what the health unit's doing. And there was an interesting story about healthy box vending machines. So, I think those are the kind of things that you can't have too much of that kind of information. It becomes, people say, wow, look at all the stuff that they're doing, to help us out. So I wanted to mention that. So thanks.
Go ahead, Sarah.
So my question is related, well, it's a question from a member of the public who posed it to me, and I appreciate I'm asking you, and it's probably not your place to answer, but someone pointed out that part of the treatment of the PFAS is that we're having soil removed to be processed elsewhere, but then we're having it returned. And they questioned why we're having it returned.
Oh, yes, I would direct that individual to the Department of, I don't know that that's necessarily accurate information.
Right.
And I would redirect them to Department of National Defense.
Okay.
Yeah, I don't think that falls under our jurisdiction. That would be for environment. Yeah. Okay. No other questions? Thank you for the report, Dr. Zimbalati. Move on to 9.1. We have a motion here, so I need a mover and a seconder. Oh, Marianne. Second by Sarah. Resolution Board of Health 2024-06. Whereas the North Bay Parry Sound District Health Unit has held a contract with Healthcare Insurance Reciprocal of Canada since 2013. And whereas the service provider and costs related to the service has been very satisfactory to the management and the Board of Health. Therefore, it is resolved on the recommendation of the Finance and Property Committee that the Board of Health for the North Bay Parry Sound Health Unit approve continuation of the contract for the General Insurance Program with Healthcare Insurance Reciprocal of Canada until notified of any changes, and furthermore, that the Finance and Property Committee be updated annually at the minimum on insurance matters. Any discussion on the motion? If not, let's call for a vote. Rick Champagne, yes. Karen Cook.
Yes.
Sarah Inch.
Yes.
Jamie McGarvey's still not on there, is he? No, okay. Tim Shepard.
Yes.
Marianne Stickland.
Yes.
Morris Switzer.
Yes.
David Wolf.
Yes.
Carried.
Over on that earlier.
Oh, I signed the wrong spot. Next item, correspondence. Everybody's had an opportunity to look at it. Nobody want to bring something forward. It's all good. Perfect. New business 11.1, North Bay Parry Sound Health Unit Strategic Plan. Why Paul and Danielle are here. Pardon?
Why you're all here.
Okay, I need a mover and a seconder. Morris Switzer. Dave Wolf. Any discussion on the motion before I read it? Okay. Or should say. The reds is all the changes, right? Therefore, be resolved that the Board of Health of North Bay Parry Sound Health Unit approve the strategic plan for 2024 to 2027. No discussion? Need a vote. Rick Champagne, yes. Karen Cook.
Yes.
Sarah Inch.
Yes.
Tim Shepard.
Yes.
Marianne Stickland. Morris Switzer.
Yes.
Dave Wolf.
Yes.
Thank you. 11.2, Board of Health bylaws.
Thank you. Thank you.
Need a mover and a seconder, please, for 11.2. Tim Shepherd. Second by Karen Cook. Whereas the Board of Health received a reviewed written notice in June 26, 2024, agenda package of the proposed revision of the North Bay Health bylaws. And we had all an opportunity to read them. Changes, or do you want me to read them all out?
We have Jamie on.
Jamie's on. Okay, thank you, Jamie. Welcome. Agenda, members of the Board of Health. Want me to read the whole thing through, or anybody on? I'm asking.
We can vote on that.
All right, I'll read it through. Members of the board shall have the right to propose an item for agenda. It is recommended that such receive in writing, including all relevant attachments, by the recording secretary 14 days before the meeting in conclusion of the agenda package. For more urgent or confidential matters, the Board of Health members may propose an agenda item for the after the 14th day timeline or at the time of the meeting. For any agenda items not included in the Board of Health meeting package, the Board of Health will vote an amendment to the proposed agenda prior to voting to approve the agenda. As which other motions, the board could decide among several actions relating to the proposed agenda item, including but not limiting to adopting, rejecting, amending, referring or deferring the proposed item. Attachment related to the new agenda item proposed and adopted at the time of the meeting cannot be added to the agenda package. Section 1, the business of each meeting shall normally be taken up in order to described in the agenda. However, the chair, with approval from the board, may vary the order of the agenda to better deal with the business in hand or at hand. Appointment of standing committees, auditors, and legal advisors. At the first meeting, the board shall appoint, recognize by resolution the following. The Finance and Property Committee comprised of all board members to deal with the matters of finance, banking, insurance, and property. B, a Personnel Policy Labor Employee Relation Committee comprised of all board members to deal with matters related to collective agreements and employment policies, non-unions. Section 4, the chairperson of the board shall ensure the Board of Health fulfills its government's responsibility and the Board of Health bylaws, code of conduct, and governance manual are followed. Section 5, medical officer of health absent or unable to act, an ability to act, where it is necessary may appoint an acting medical officer of health in a short term absence of the medical officer of health, associate medical officer of health from one of the following health units, by qualified locum medical officer of health or by a physician previously approved by the Board of Health resolution to ensure that the statutory duties of the powers of the medical officer of health be continued to be fulfilled. 1, Algoma Public Health, Northwestern Public Health, Porcupine Health Unit, Public Health Sudbury and District, Renfrew County and District Health Unit, Simcoe Muskoka District Health Unit, Thunder Bay District Health Unit, Temiskaming Health Unit. Therefore, to be resolved that the Board of Health approve the proposed revision of the Board of Health bylaws regulating the Board of Health as presented. Discussions on the motion. Thanks, Dave. No discussion? Okay, we'll ask for a vote. Rick Champagne, yes. Karen Cook.
Yes.
Jamie McGarvey.
Yes.
Yes. Sarah Inch.
Yes.
Tim Shepherd.
Yes.
Marianne Stickland.
Yes.
Morris Switzer.
Yes.
Dave Wolf.
Yes.
Carried. Recommendation to access free private wells watering testing. I need a drink of water. Yeah, mover and a seconder, please. Tim Shepherd, thank you.
I'm on a Wells.
Second by
I'll second it. Jamie M.
Jamie McGarvey. Thank you, Jamie. All right. Whereas the private water testing is currently available through Public Health Ontario laboratories to the residents who rely on drinking water from a private well or treated lake water to verify their drinking water is potable. And whereas the Honorable Ministry Sylvia Jones has provided verbal reassurance on multiple occasions, the private water testing will remain free to all residents of Ontario. And whereas rural areas of Ontario comprised of a higher volume of private water sources will be potentially be the most impacted if the cost-saving measures do not consider realism for the private water testing services, including transportation of the samples by the residents to the point of drop-off and delivery from the point of drop-off to the lab. And whereas the private water testing is already individualized by the residents and further changes to the accessibility of water testing could further reduce utilization, putting the residents at risk of consuming non-potable water and the potential of waterborne illness. And whereas the Office of the Auditor General of Ontario report also identified quality improvements, opportunities for the coordination of the communication of courier services used to transport the water sample, which maybe contribute to the cost reduction without impacting Ontario residents, and also maintaining the integrity of the sample being tested, reduce the number of samples rejected from the laboratory due to not arriving within the required time frame. Therefore, to be resolved that the Board of Health of North Bay Parry Sound District Health Unit recommend that the Public Health of Ontario within the Quality of Improvement Plan assess the geographical area of which private water samples are collected, and with the support of the Ministry of Health ensure that drop-off locations, courier services, and laboratories are coordinated to meet the needs of the geography to maintain the integrity of the sample being tested. And furthermore, that the Board of Health provide correspondence of these resolutions to the Honorable Doug Ford, Premier, the Honorable Sylvie Jones, Ontario Minister of Health, Vic Fideli, MP for Nipissing, Graydon Smith for Parry Sound, Muskoka, John Vantoff, MPP of Timiskaming Shores, Mary Scheer, President of CEO of Public Health of Ontario, and the Board of Health Associations of Local Health Agencies, ALPHA, and members of the municipality. Okay, discussion on the motion. Go ahead, Boris.
Jamie.
Jamie, go ahead first.
Oh, thank you. I'm really pleased to see this here because there have been some rumblings around the municipalities as to, you know, I guess maybe we could put it down that they're not sure whether the government verbally would fulfill what they're saying, but there is a concern. I've seen some resolutions circulating as well. And I think that it is really good that we're doing this to try and keep that service, because as you know, the area that we're in relies heavily on public health collecting those bottles and having them sent out for sampling and results. So it is a vital service, and hopefully we can keep the funding flowing for that. Thank you.
Thank you, Jamie, for the comments. Morris was up next.
Can I just respond?
Yeah.
I just want to clarify that this is not about funding for health units to collect the samples and transport them. This is about the Public Health Ontario labs possibly divesting of the testing of private well water samples, or private water samples be drawn from the lake as well. So Yeah, we do, we have heard in the Auditor General of Ontario's report that they recommended that Public Health Ontario Labs divest of this service. And so we really want to advocate that whatever, if this divestment is occurring, that the testing capacity in Ontario remains robust and sufficient, and that the network of couriers services to ensure that the samples are processed in a timely manner remains. So public health units who collect the samples were not necessarily impacted by this change. We do anticipate we will continue being a place where the public can drop off their samples. It's just then from us, where are the samples going to? And we want to ensure that that accessibility is still present all across the province. As the briefing note indicates, the Minister Sylvia Jones has indicated that it will remain a free service. We have included a news article in the correspondence package that supports that, but we don't have anything in writing. So again, just to keep it on the radar that yes, we do want it to stay free as the government has indicated it will be, but also to advocate for that continued access.
But just correct me if I'm wrong. We do collect it, but then we only collect it, I think it's a couple days a week because we can't hold them over the weekend, obviously, and it'll get transferred over the weekend. That's still in place, right?
Right. So we don't accept samples on a Friday or a Thursday if a Friday's a holiday. So because there is that transportation time, because the integrity of the sample needs to be maintained.
Yeah. I think Morris was.
You answered a lot of my concerns. We don't need another Walkerton, you know. And I just a comment. I'm presuming that residents of Ontario include people that live on First Nations. I'm presuming. I personally know of at least 4 communities where they've been on boil water advisory for 30 years, you know, and more.
So this doesn't relate to small drinking water systems, but where there's a private
wells. Okay.
I believe Marianne was next, right?
Just echoing Jamie McGarvey's points for the West Perry Sound. It's exactly the same in East Perry Sound. Everyone is on board. So we do need the services vital.
Go ahead, Dave.
I am not on a well. But I understood your explanation of why this motion has been brought forward. But the motion itself, when I read it, I had to read it a couple of times to try to get my head around what we were trying to say. It was convoluted. And the fact that you felt compelled to clarify it for us and to explain it to us goes to something that we'll probably talk about at some point. Is just the language used sometimes to communicate our message, especially when I look at, no offense to my friends who are elected, but when I look at the list of people to whom this is going to be sent, they're all intelligent individuals, but I kind of think those of us who sit around this table are relatively intelligent too. If we needed it explained to us, somebody's going to have to explain it to them. So just a point of consideration on motions, if we can sometimes dumb it down a little bit, and I don't use that term to be negative. I literally mean just to bring the language down to a layman's area might be helpful.
Any other comments? Just one comment, like I know we're going to talk about in the report of the Alpha. It was talked about then, and what some of the questions did come up to Sylvia Jones about the drinking water. She basically said, no, nothing will change, but again, in writing, it'd be nice, right? It's talked about, so again. Okay, so no other discussion. I'll ask for a vote. Rick Champagne, yes. Karen Cook,
Yes.
Sarah Inch,
Yes.
Jamie McGarvey,
Yes.
Tim Shepherd,
Yes.
Marianne Stickland,
Yes.
Morris Switzer,
Yes.
Dave Wolf.
Yep.
Carried. Thank you very much. 11.4 self-evaluation survey.
Right, so all participated in the self-evaluation that several weeks ago, and the report indicates your responses, and I think there were some themes that came out the self-evaluation. So based on the themes, we have produced an action plan and just presented for your information and comments. I think it can be an evergreen document, so not necessarily something written in stone. As maybe opportunities or needs arise, it can be adjusted, but I just basically I'm checking in as to whether the action plan you see presented here would appear to meet the needs that you feel you have related to.
Yeah.
Go ahead, Dave.
Thanks. I was happy to see the report and I'm glad everybody participated because we all should be doing this when we're asked to. And I like the action plan. I'm happy to hear you say that you'd like to, it has basically a living document. We can massage it and mold it and change it as we need to. And a number of things that I mentioned tonight, I want to acknowledge are in here. Some of the things that we've already discussed. So it's nice to see that the responses to the questionnaire were not just acknowledged, but they were, we've really looked at them. We said, oh, there are a couple of themes in here that we might want to monitor. And so well done.
Any other comments or questions for Dr. Zimbalati? No, thank you for the report, Dr. Zimbalati. Okay, 11.5, Associate Local Public Health Alpha 2024 Meeting Conference Report. Mr. Shepherd, sir.
Mr. Champagne.
You got a copy of it there?
You got a rough one. I missed it.
I always had an opportunity to take a look at it, I assume. We're just going to go through it quickly. We did the walking tour. It actually was really nice talking to some of our colleagues, especially some of the other chairs and issues that we all have. The one issue that kept coming up was we did the medicine bag workshop in the morning. That was pretty interesting. We made our own little tobacco pouches, which was pretty interesting, and the story that goes with it, which was more interesting. Most of the discussions we've had around the table and talking about the merger, and the Sudbury was there, and so was Sault Ste. Marie, but the trifecta was there, which they were sat on the board and talked about it, which was east of Renfrew, and actually some of the members from Renfrew, the medical officer was there, and Joanne, one of the board members, was also there. When you have a one-on-one with them, it's a little different how they feel about it. And after lengthy discussions with them, if things would have been a little bit differently, and if the ministry wouldn't come out the way they did and leaving too many blanks, they probably would have come on board. But even the trifecta talked, and they said there was issues with the union negotiations. There was issues with board recognition. There was with staff, and once they got it all together, they all agreed to it. But then they said, what's the monetary going to be at the end? Nobody knows what the final is going to be. What's it going to be for the next year? What's it going to be for the next 2 years? What's it going to be for the next 3 years? It's kind of scary when you think about it, because everybody's under the same impression that we're not exactly sure what the end is going to be. And the promise doesn't give you enough to really work with. And like I said, it was pretty, it was a good discussion. Talk about the arrival of 1.2 million people, in which great discussion that here's what's happening over the last year or two, that there's 1.2 million more Ontarians. So how do you deal with it? And even listen to the minister and the premier. Again, he says he's a numbers man, but we're growing. We're the fastest growing province, even in the States, as far as states go, that how fast Ontario is growing and how important public health is. Well, give us more direction. That's what I'm getting at, and that's what they get out of it too, right? And unfortunately, the minister, Sylvia Jones, when she got up to speak, she said, I got nothing to say because the premier has said it all. So again, water, talk about the water, the wells, and get sampling done. And she really saying, no, it's not gonna be on the back of the municipality. It's not gonna be in the back of the health units. It's still gonna be dealt with, and it's still gonna be free. So again, it was a good conference. We got a lot out of it. And again, talking to people one-on-one is totally different from, you see them on the screen, and we learned a lot, right, Tim? You don't have anything to add about it, but it was a great 2 days. So any questions? That was our report. So do you have anything to add, Tim?
And just the only thing I'd add is if you look at the attachments that Sherry did in our little thing, because the 2024 resolutions were too lengthy for us to even talk about. They're very interesting, and the resolutions are based on concerns other health units have on a variety of issues. So that was an eye-opener as well. Just the fact that there was some very good resolution. I think there's 8 to 10 or something we went through and voted on, and we actually were able to vote. But they're quite interesting resolutions if you want to read them over. And they were all being put forward to the province. I think they pushed forward with every single one was voted to continue to advance it.
And the one that was talked about the most was the nicotine pouches too. That was brought up, and we're on the same line as what they were talking about. So it was good, and I appreciate you sending us, and I think we got a lot out of it. So thank you.
I have a question.
Yep.
Can you talk about the discussion around the increased beer and wine sales?
Yeah, that was another one that went on for quite a while. The stores are selling beers and wine.
Oh, that's a big one.
Yeah.
Dr. Moore is not happy about that. He's not even happy about that.
The motion did go through, and it was unanimous that they should relook at it for sure. They don't agree with it. The same one as we sent out. And I guess it's how you label it and how they come across. I know we're on live, but don't want to talk about our ministers and everything else. But public health knows what is right, and the motion has gone to the premier and to the associate ministers and the medical officer. And again, like Tim said, Dr. Moore was pretty vocal about how he felt about it. So
it's a public health perspective going against a monetary perspective, if you know what I mean. And that's where public health has got genuine concerns and legitimate concerns. However, politically, concerns don't amount, I don't think, to the level where it will be canceled, even if they're being voiced by very articulate, smart groups of people.
We're talking in circles here.
Yeah,
but
well,
at the end of the day, we all know what the value is.
Yeah, it's our motivation against either monetary or voting motivation. Who's going to win?
But all the public healths are on board.
Yeah.
So
I'm curious, do they provide any data about like the costs of, negative health outcomes from increased alcohol use?
No, they didn't. No, that never came up.
Right.
Yep.
Sorry. If you read the medical officer of health, the chief medical officer of health annual report, was released in May 2024, but it's officially the 2023 report. It focuses on substance use, so alcohol, tobacco, and cannabis and opioids. And there is a lot of data in there on costs associated with all the different substances. So it's a very informative report.
For instance, I understand that, one of the main things that we prevent with the clean needles is that, there's the hepatitis, which a prescription apparently is $20,000 a month and takes 3 months, or endocarditis, dirty needles, and that would require a hospital stay, which is $3,000 a day or something like that. So I can't imagine that the economic costs would outweigh the future costs of providing healthcare to these people. But
that never came up. So I'm sure there's something out there somewhere that you can find, but that never come up at the Alpha conference.
Thank you for sharing.
Any other questions?
Did they have sandwiches?
Oh,
never mind.
There were carrots and all healthy things that we're supposed to eat.
Sorry, Chair.
It's all good. So we 12, we don't have it in camera, obviously, right? Everything's good. So adjournment. I'd like to thank everybody for coming out tonight. Great discussion. And thank the staff for strategic plan in place, and hopefully we'll see it on our website soon, and people will be able to look at it. And again, echo with Morris was said, we've always said at the beginning, it's nice to get out there what exactly the health unit does. So let's get it out there and show them exactly what we do. Our board members and staff. Thank you very much, and have a good evening.
Thank you. Have a good summer.
Yes.
Yes.
Good night, everybody.
You in the fall.
And Sharon's going to be here for a while, eh?
No.
No.
I will not be.